Major funding for these programs is made possible by grants from Chase Commercial Term Lending and Capital One Bank, New York Community Bank, the Witkoff Group, M&T Bank, Perfect Building Maintenance, Genova Burns, Jean Tomasi and Webster, Greenberg Traurig, Kilroy Architectural Windows, New York's Window Company. Additional funding is provided by grants from AKA Hotels, Corman Communities, Aerial Property Advisors, Bank of America Merrill Lynch, Bank Leumi USA, Briarwood Organization, CBRE, Colliers International NYC, CPEX Real Estate Services, Cushman & Wakefield, Customers Bank, DDG, Dime Savings Bank of Williamsburg, Douglaston Development, Levine Builders, First Nationwide Title Agency, Flushing Bank, Friedman, Gemini Real Estate Advisors, Hap Investment Developers, Herrick Feinstein, Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, James Orphanides, Chairman USRealty.com, John Katsimides, Red Apple Group, Margolin Weiner and Evans, Madison Realty Capital, Massey Knackle Realty Services, Matone Group, Meridian Capital Group, Newmark Grubb Knight Frank, New Banks, People's United Bank, SJP Properties, Sterling & Sterling, Stonehenge Partners, TD Bank, Terra CRG, the CUNY TV Foundation, the Continuum Company, Urban American, and these friends.
So you get these kids, they're born in the Bronx, then they decide, Bronx Science, MIT. Not sure I want to be an architect, I want to be an engineer. Maybe I'll be a physician. I don't know. Why am I going to be a pediatrician, pediatric cardiologist? Healthcare systems, what do I know about it? All of a sudden, they become the executive vice president of the Mount Sinai Medical Center and the president of the Mount Sinai Network. Happy to have Arthur Klein with me today.
And I'm delighted to be here. Thank you.
So Arthur, tell me about your great-grandparents and your parents. You told me that there was as in many cases, they wanted to leave Europe because of the wars and the conscription to be in the army. So.
Exactly. I mean, I'm a product of the massive wave of Eastern European Jewish immigration that occurred in the first and second decade of the last century. My paternal grandparents came from Budapest. They got married in Budapest and immediately came to the United States because they believed they'd have a better life here. And my maternal grandparents came as adolescents, unmarried, from the Pale of Settlement that was that defining area between Poland and Russia. My grandfather came as a 17-year-old to avoid conscription in the Russian army. And my grandmother came because her father settled here and he said, "This is where you belong now."
Now, one side of the family ran a restaurant, you said, in the Lower East Side?
Exactly. My maternal great-grandfather came over from Russia in the late 1890s, opened up a kosher restaurant on the Lower East Side, squirreled away money to slowly bring his family, his wife and his 6 children over, and they came sequentially. He firmly believed that both the economic opportunity and the tolerance and freedom of Jews in the United States was unparalleled.
So then your father, you said, well, your grandfather was a custom tailor, right?
My grandfather on the Hungarian side was a custom tailor. And my grandmother, as a young girl in Budapest, learned needle trades. I mean, that's what young girls often did. And together they ran a shop on the Upper East Side that catered to the carriage trade that wanted custom-made clothing.
Really? Now, your father was born where?
My father was born in Lower Manhattan. My mother was born in Brooklyn. And they both met as teenagers in the Bronx, which was then becoming a large middle-class Jewish settlement.
And your father, you said to me, got into the textile business.
He did.
Didn't want to go into the custom tailoring.
No, he got into the textile business and remained in one way or the other in the textile business all of his life. But interesting, Mike, my father's personality was that of an extrovert, and I think most people who work with me in the health industry would say I'm the same. My father always said to me to the day he died that his greatest skill was sales. And to a large extent, that's what dominates my own professional life.
Right, which is unusual for many members of the healthcare profession, but that's what distinguishes you from a number of other people.
And it's what I love doing most. I love elaborating a policy or a strategy and then basically getting a consensus around that, if you would, a different type of sales.
So you're born at Barnes Hospital?
No, I was born at
Bronx, Lebanon. Was it Bronx, Lebanon or Bronx?
No, it was the Lebanon branch of what became Bronx, Lebanon.
And you grew up on Pelham Parkway?
I grew up right off Pelham Parkway.
And Barnes Avenue.
And Barnes Avenue.
And you went to public school?
I did.
And you told me when you were growing up, you spent summers at camp. One time you even became a camp counselor.
I did.
Your mother was a biology teacher, if I
remember.
Correct. You decided that you really wanted to go to Bronx Science, which was, the preeminent, and it continues to be the preeminent part of the city educational system. Now, how did you decide on going to MIT?
Well, it's interesting. First of all, I would say that I had the great fortune of being the beneficiary of one of the great public school systems in the world, which was the New York public school system in the middle of the last century. I got a great education and then was able to avail myself of one of the best high school educations available in America for free, which were the specialized high schools in New York. I went to Bronx Science because it was in the Bronx. I lived there. I passed the entrance exam. I got in. I also understand, as I look back, that I was a product of the intense years of the Cold War. And to my generation, the Russians' ability to put Sputnik up in space, to in essence leap over the United States in that notion of scientific supremacy, meant that there was a real push both within my family and within the people I interacted with in the school system to say the highest calling is science. America needs scientists. That's where people who...
scientists. It was science and scientists. Because at that time you said to me, you really didn't have a desire to be a physician.
That's correct.
Even though, as I normally joke with many of the physicians I've done their life stories, that it was in the DNA of the family to become a physician.
Not at all in my experience.
Right.
It was in the DNA of my family that the highest calling was to do something in science and to make sure you became a professional. And to me, the iconic institution of American science was MIT. And to my parents, it was too. And I have to tell you, Mike, I don't know where they got that concept. We didn't get scientific journals in my house. Maybe my mother had a little bit of it from her continued interest in biology. But I knew from an early age that MIT was the citadel.
So the kid from the Bronx enters MIT and wants to become an architect. Why was it architect?
So, if being true to myself, the most appealing thing to me was always arts, history, and architecture seemed to be able to kind of blend a scientific and technical discipline with a love of art, a love of history. And so I started out in the School of Architecture.
And what happens?
Well,
one of your professors, right?
So, architecture in those days, the 1950s and 60s were a different era than what people experience today. We were still working out our ethnic divisions in this country. We were still working out, perhaps more silently, our ethnic prejudices. And I had an advisor who very quietly, politely told me that he didn't think that the Jews made it big in architecture in America. Now, I was a young kid when I went to college. I was 16 when I graduated high school, turned 17 that summer. I was impressionable. I thought professors walked on water. I couldn't distinguish whether he was giving me objective evidence or, quite frankly, doing me a favor because he didn't see in me that kernel of incredible talent that was going to enable me to rise above.
Do you realize that Frank Gehry's name was Frank Greenberg?
Oh, I know that. And you know, and there are a lot, the world has changed today, and I'm very, very aware of that because I still am a kid in a candy store when I watch a new building go up or when I read the real estate section of the New York Times. But I was an impressionable kid. And I realized early on at MIT if I wasn't going to go into architecture, and by the way, their approach to architecture was much more one of architectural engineering.
Since you are told quietly that even though you might have the technical ability to be an architect, you then decide to continue your studies at MIT in science.
So I ultimately graduated with a degree in biology. Biology at MIT was not the traditional biology of many other universities. It was already molecular biology. I would say this, Mike, MIT was an extraordinary place to go to school. You were surrounded by people of great, not just intelligence, but passion. Passion to discover new things, passion to explore.
You have a degree in biology, but as you said to me when we got together, you didn't have adequate courses for medical school. So you applied to a few medical schools. And how did you decide on, you know, you were in the Bronx. Even though the family may have been from Brooklyn at one time, there was no affinity. How did you decide to go to SUNY Downstate?
Well,
which was a great school, but you know, you had also been accepted to Tufts, you told me.
Very good memory, Mike. Thank you. I'm flattered. So Downstate accepted me. They accepted me without some of the prerequisites that were generally part of applying to medical school. I knew that it had a reputation for clinical excellence. It was quite affordable after my family spent a lot of money on an MIT education. Quite frankly, it allowed me to use something that was very powerful in those days as well, which is the New York State Regents Scholarship. And I went to Downstate.
Now, your first 2 years at Downstate, you said you really weren't stimulated. What happened? I mean, the first 2 years of medical school is really technical. There's really limited patient involvement. Maybe it's changed today, but at that time it was more of a school.
So the model of education that I learned at MIT was one of self-exploration and discovery. You were encouraged to do that. The lectures were good, but you had a lot of ability to be creative in laboratories and to take your own path of learning. The medical school curriculum in those days was very much rote. And it was a very different type of biological approach. I never dealt with anything in biology bigger than the concept of a molecule or a bacteria or a virus. And this was comparative anatomy. This was microbiology in a different kind of way. So obviously I got through, but I didn't find it a particularly stimulating environment.
So what happens at the beginning of your third year?
So now I'm in the hospitals, and suddenly I find that the way I'm expected to learn and the way I'm expected to perform is completely different. It's about relating to patients. It's about relating to the doctors who are your mentors. It's about learning through observing, learning through the verbal technique, and being able to question and challenge in a different way. And I loved it.
So you finished the program. Now, when you were in the last 2 years, how do you get a decision that you wanted to get involved with pediatrics?
So I'm going to say something which I hope doesn't come across as crass or insensitive. But when I worked with kids in downstate, we did our pediatrics at Kings County. And it was really a very, very needy population with respect to kids. Whatever I was doing made me feel, gee, I'm doing something that has the potential to have a 7 or 8 decade impact. And I love the kids. And when I was on the adult floors, I just didn't feel the same passion. I was concerned. I wanted the outcome to be good. But I think what drove me to kids was the passion I felt.
At that time, and continuing today in medicine, you complete your program and then there's a matching program.
Correct.
And your decision, you could have matched to a couple places. Your first decision that you wanted to go to New York Cornell. How was that?
So, you know, circumstance and opportunistic things always play a big part in anyone's life. I happened to be living with 2 friends who are still my closest friends on the Upper East Side of Manhattan. I took a couple of electives at the New York Cornell because it was walking distance and a great institution. There were a couple of faculty members in peds who, to me, exemplified the kind of mentor, the kind of role model that was empowering. and I made New York Cornell my first choice.
So you entered New York Cornell, and you're entering Cornell in 1972. And you spent a number of years at Cornell. Let's talk
34.
34, but let's go over the 34 years before you decided to return to Rhode Island, let's say, in the MIT area.
So I started out and did a pediatric internship, residency, and fellowship in pediatric cardiology at Cornell. I chose pediatric cardiology because I had the fortune, and again, this is just one of those anecdotal things that happens. I took an elective in pediatric cardiology very early on in my internship, loved it, was intrigued by it. I picked the internship because I didn't feel I knew much about congenital heart disease and found a passionate place for myself. Got superb training in what was then one of the great centers in elaborating the natural history of congenital heart disease, and stayed on as a faculty member. In those days, we're expected to have the, if you would, the trifecta. A little bit of research, a little bit of teaching.
Right. So so basically you were at a faculty practice initially.
Exactly.
And then what happens, like in 1984, I believe, there's because of the relationship with New York Cornell and the Hospital for Special Surgery, an opportunity.
So the Hospital for Special Surgery was the orthopedic arm, and still is, of New York Cornell. And I got a call one day from just one of the true great leaders in New York medicine, Dr. Philip Wilson Jr., who was then the surgeon-in-chief of the Hospital for Special Surgery, who said to me, would you be interested in running our peds department? And I said to him, well, why are you calling me? And he said, well, as a person dealing in pediatric cardiology, you have a reputation for being well-versed in the perioperative care of children. You're considered an excellent clinician. And we want to grow pediatrics at special surgery to make it the safest place possible for orthopedic surgical care of children. And you certainly care about surgical care. And I thought it was an interesting opportunity. I wasn't certainly an orthopedic surgeon. I didn't know rheumatologic care more than what I had been educated in previously, but it was my introduction to administration, and that was clearly a sentinel event in my life.
And that changes, that continues on. So that's 1982, 84. What happens next?
So I then am starting to develop an expertise and perhaps a reputation in administrative matters. I liked it, and I got offered the chairmanship of pediatrics at Lenox Hill Hospital, which then had a full-service pediatrics department, including a residency, and a superb clinician who was stepping down as chair, but had a reputation that extended to the department. And in my deliberations there, this came to the attention of new leadership at New York Cornell, who said to me, we want you to stay here. You're valuable to us. They offered me the vice chairmanship of pediatrics at Cornell, in essence still being a moderate-sized fish, but in a much bigger fish tank. And I stayed in my comfort zone, my if you would, professional home, and moved up the administrative ladder.
Now, fast forwarding, this is when the world of the first time that hospitals were creating networks and there were mergers. At that time, prior to this, New York Cornell was New York Hospital, and then in the early 90s, there was the merger world.
You got it.
And what happens with Arthur
and the
Klein,
network world.
And the network and the merger world.
So here again, there's a confluence of events, and I smile when I talk about it because I really was at the right place at the right time. When community hospitals started joining academic medical centers, they looked for where was there a sweet spot in terms of program development. Well, if you were a community hospital, you had to have a department of medicine. You wouldn't have survived. You had to have a department of surgery. In general, you had underdeveloped pediatric services. The community expected you to have them because it's part of being a community asset, but you generally didn't have highly evolved pediatric services. So pediatrics became a place for saying, how do you rationalize a network? What can a network do in expanding quality and service to community hospitals? So I increasingly got called upon to say, can you fix the emergency room problems in pediatrics here? Can you figure out how they can cover their inpatients there? And I liked it. I liked thinking about the relationship I liked crafting the relationship. I liked doing the business planning. I liked doing the academic and professional planning. And that put me, if you would, in the highlight of a medical exec who really cared about systems. And as a pediatrician, I understood that pediatric care is local care. Families will travel for the tertiary care, but they need those centers locally. So the whole notion of systemness appealed to me.
Mid-90s, what happens then?
Mid-90s, New York Hospital organizes to have a much more formal executive team in charge of a very rapidly growing network of hospitals. And given the work I had been doing as vice chairman of pediatrics, then executive vice chairman, they asked me to become the senior vice president and chief medical officer of their healthcare network, which in those days was called New York Hospital Healthcare.
And then New York Hospital has the merger with Columbia.
Correct.
And then what's your involvement at that time?
And at that time, I'm the executive, as the two management teams come together and the new executive team is created, I'm the executive who's asked to bring together the two health networks of two large academic systems. Very different, because New York Hospital's network is one of essential corporate ownership, a sponsorship model, and Columbia's network is a sense of affiliation,
over there.
relational.
So you're there, and so what happens later on? You had met somebody over your career who was like a mentor, and he takes a job with Lifespan?
He takes a CEO position at Lifespan. His name is George Vecchio, and I owe a lot to him because George, A, was the type of mentor who entrusted me to find my own place, but constantly guided me. And he had a tremendous executive ability to get people to come to consensus. Not random consensus, but guided and focused consensus.
You had 34 years of closeness. How'd you leave the womb, as we'd say, to go up to Rhode Island?
Well, I saw the world of systemness from the New York Presbyterian point of view changing. And I saw that they were going to increasingly concentrate, and this is an objective statement. It's not in any way a critical one. I loved and do love that institution and have immense respect. But they saw their sweet spot continuing to resource the two academic medical centers. And my passion was in systemness. My passion was in affiliated relationships. My passion was in system faculties. And so I began to say, well, maybe I need to look at other opportunities. A very unique opportunity came up in Rhode Island. In a healthcare system that was looking, A, to create greater rationalization, and also to tighten its relationship with Brown Medical School. So I went up to Rhode Island as a dual executive with an associate dean position in the medical school around strategy and their hospital relationships, and as the chief physician officer in the healthcare system, responsible for the physician alignment, clinical strategy, program development, et cetera. Both of them a sweet spot for me.
Spent about 3 years?
About 3 years there.
And then there's this little hospital out in Long Island, a good children's hospital called the Schneider's Children's Hospital, part of the North Shore LIJ system. And their chief of medicine was retiring, right?
Correct.
And what happens next?
So I was very pleased and flattered to get a call from Michael Dowling. Now here we have to kind of say, I'm a New Yorker. I'm a New Yorker to the core. It's in my DNA. And I wanted to return to New York. So I had all my groundings still in New York.
You were still here,
even while I was in
okay?
Rhode Island.
You may have been up there, but you were back in New York always.
And obviously, also in my DNA is my love of pediatrics. So I thought to myself, to run a children's hospital within a large and expanding healthcare system, a healthcare system that said to me, we're truly committed to elevate the status of this children's hospital, I said, gee, what a wonderful opportunity. I couldn't turn it down, and I was really delighted they accepted me for it.
And when you take care of that, then Michael says, Arthur, I have another role for you.
So I think, as you know, Mike, North Shore LIJ healthcare system expanded into Manhattan with the acquisition of Lenox Hill Hospital and Manhattan Eye and Ear.
And they had Staten Island in the mid-90s.
Exactly. And Michael knew that from my years of working at the New York Presbyterian Hospital and System, I knew the Manhattan market very well. And he was reorganizing anyway, because the system had grown so large, to a regional executive strategy. So he asked me to be the regional executive over the Western region, which was Lenox Hill, Manhattan Ioneer, and Staten Island University
And
Hospital.
also the initial involvement with the creation of the emergency center.
Right, which is now the
at St.
Healthplex.
Vincent. The
at St.
Healthplex at St. Vincent. Then what happens? Now you want to be closer to your apartment on the Upper East Side. Mount Sinai, what happens?
Well, my own prejudice is to see life on a relational basis. I had the privilege of meeting Ken Davis more than a decade ago. I had the privilege of keeping in contact with Ken Davis from time to time. He would open his office to me. We'd go in. We'd talk about the healthcare environment. He would share with me some of his thoughts and challenges. I would share with him where my career was going. And I got a call from Ken Davis saying, I'm reorganizing. I'm establishing a new executive position as we evolve into a system and a network.
Had the decision been made of the merger with the Continuum at this time?
The decision had been made that they were now the lead partner in that due diligence process. Whether it was actually going to occur, it was too early in the due diligence to know. But certainly it was on their strategic radar screen. And, but even without that, Ken had made a very clear decision with the board and his other executive leadership that the world of reimbursement was changing, that the notion of healthcare across a population as opposed to across an academic medical center was going to be of preeminent importance. And either way, he knew he was going to build the footprint for a strategy built on population management, a strategy built on providing healthcare to a large proportion of the metropolitan area. And so being able to work with him, and quite frankly, to return to my roots in a true academic medical center.
And in many ways, similar to what your role was at New York Cornell.
Absolutely. It was the ultimate expression of the true partnership between a superb hospital and a nationally important medical school.
So what are you doing today? What's the major role?
So my major role is really helping Ken and the executive team develop a large enough clinical and academic footprint so that we can basically provide healthcare benefit, rationalization to a large population. So that could be institutional relationships, it's physician relationships, it's participating in a whole new paradigm of thinking about how strategically we manage contracts, moving from a fee-for-service environment to an environment in which we're compensated for outcomes, compensated for health maintenance, compensated for more efficient care. And it's a very exciting place and time to be.
So, you know, for the kid who grew up in the Bronx who originally wanted to be an architect, you are really an architect today because you're an architect of a healthcare system with a dynamic team of builders. And I'm very happy to have known you for many years and to have you on my show today.
Well, I'm really delighted. Thank you. It was a privilege.